Welcome back. To complete our discussion, talking about hospice care at St. Francis Hospice. Joining me is Stevie Shipley, social worker. Welcome to the program.
Thank you.
Now, I did this for Sydney in our first segment, so I must do it for you to kind of throw a little bit of a curveball. I forgot to do it for Alan, about a social worker.
Yes.
How, if individuals were interested in becoming a social worker, what's the general path that they should take?
Well, there are several programs, several ways to do it now. Well, one needs, well, I'll tell you what I did.
Okay.
I majored in psychology in my undergraduate school and then went on to get a master's degree at University of Washington.
Okay.
But at that time they didn't have undergraduate degrees in social work. Now several schools do, including OU.
Okay.
And it's usually, these days, one really needs a master's eventually to get into medical social work and into the other areas that are a little more interesting, I'd say.
Okay, and there's a variety. I did talk with Sydney about it in terms of looking at nursing and registered nurses. There's a variety of disciplines within that you can access.
And that's been the wonderful thing about social work for me. I have never had trouble finding a job. And there is a wide variety from direct therapy. One can be licensed as a private therapist and do that. One can work in mental health clinics, in hospitals, in hospice, in home health. There's just a wide range of things that can be done with a degree.
Okay, well, thank you so much for answering that curveball there. Now, I want to focus with you, Stevie, on looking at social work services within the hospice umbrella. Tell us about sort of the philosophy of services. I mean, are these services only ones that maybe patients may ask you for, or being a part of St. Francis system, are you able to bring suggestions that may be helpful to patients? I mean, how do you start to look at just the general concept of services?
Well,
or resources, yeah.
The way I describe my role to patients is that I provide counseling and support for our patients and their families while they're in hospice. And then sometimes people need legal or financial or insurance sorts of information. Sometimes they need help with caregivers because there just aren't enough people in the home to do it all. We get a lot of questions and give a lot of information at the very beginning just about end-of-life wishes. We help people complete their living wills. We help people obtain power of attorney if that's going to be needed, and it often is.
Okay.
So we just try to help people prepare for what's going to be coming down the road and the decisions they're going to be needing to make, and also to help set up the way that they're going to be able to care for their loved one at home.
Okay, so if the person is needing, like you said, even reviewing their insurance information and knowing, do they have the beneficiaries listed that they wish, or if they wanted to set up a trust for someone, if they have those resources to move it into, you'll actually help them to get those things in place.
Well, I would
or to review them.
I would certainly refer them to an attorney for some
But
of
that's what I'm
those
saying.
things.
You would help them by giving them the referrals and having people work with them, so they don't have to take the energy to try to figure that all out themselves.
Right. Right.
Okay.
And we've actually helped people obtain guardianship of grandchildren. It just, as you can imagine, it can be very complicated. And there are a lot of concerns that people have about how things are going to go on after they're gone.
Now, in this whole concept, too, I'm thinking about, based on the person's faith, how they wish their end-of-life kind of celebration to be, whether it's a funeral or whatever it is. If they're struggling with that, do you assist with resources to help them get all of that settled? And if they're having sort of some family differences of opinion, do you work to bring the family together to listen to what the person is saying and kind of help work through that so it's not such a problem afterwards?
I think you've answered my question. Yes, and I've worked with hospice long enough now, it's been 16 years, that I've attended a lot of funerals and helped people at that point just to figure out what it is they really do want. And so, if nothing else, I can tell them about the wide variety of things that people do, and they can kind of take off from there with their own wishes and their own decisions.
Now, as I mentioned and talked with Alan in reference to, you deal not only with adults but with children, and sometimes we forget that they can be critically ill, terminally ill as well. We always like to think it's when you get older, but of course we know that that's not what really happens. As you work with children in those kinds of settings, do they have some maybe unique desires or wishes that maybe the adults don't have or adults need to be aware of?
Just, they want their parents to be close. That's usually their most basic sense of security is their own parents and their own family. And they want to know that, they kind of want to know what's going to happen later, and, you know, depending on their age. But usually families and ministers have talked about those things, and they have a sense of what they think they are going to expect, you know.
Okay. So it's kind of helping prepare them for
Right.
what might be the next experience. An adult may know that a little bit, but the
Right.
child doesn't have that experiential base to know that.
Exactly. And, you know, children's literature is wonderful in that sense. I often think that, you know, I get more from children's books about some of these really difficult subjects than from an adult book, because they have, you know, they have such a way of laying it out and speaking to children where they are, you know. So there's some wonderful books these days that address that. I suggest that people watch The Lion King, you know, about the cycle of life.
You know, that is really true because it does have a really good explanation and kind of how life is still going on in this cycle, but it's also a normal type of cycle and expectation.
Exactly.
Let me ask, because you throw that out too, I talked with that in reference to Sydnie and Alan about the different faiths that you serve. And of course you are doing the same thing. So if people are wanting to really incorporate, once again, some of their religious tenets into some of the resources or services, but don't know where to necessarily get them, you will help find what is specific to that person's belief system and background as well.
Well, sure. And, you know, we've called different, you know, we have a large Native American population, as you know, and so usually they know who to go to perhaps purify the room or perform a service or, you know, whatever is going to make them feel best about what's happening. But in the absence of that, we would have ways of finding the people who could help.
Okay. Now, are there certain checklists maybe that if a person is maybe more quiet and reserved that you might go through to ask them, have they considered these things? Because sometimes people don't sort of have that energy to think about, did I get it all? Did I get it all? You know, do you help that way as well?
Well, I don't want to push people further than they want to go. I don't want to give them more anxiety. I mean, my goal is to relieve their anxiety, not to cause more. But I would talk to them again about how they want things to be.
But if they say, I'm just not sure if I've covered everything, do you kind of help them go through some things to think about?
Yes, you know, and those would be things like end of life legal questions and that sort of thing, and just how they want things to be as they go along.
Okay, well, I'm always out of time there.
I
Thank
know.
you so much for joining me,
Sure.
Stevie, and thanks for all your work.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150, or if you're on the email trail, please email me at healthalertusa@gmail.com. And also, please visit me on YouTube at youtube.com/healthalertusa. And remember, talk to your pastor, talk to those in your environment, and if you need hospice care, get in touch with resources that can help you. Take care. This program would not be possible without the support of OU Physicians in Tulsa.